Welcome everyone to today's webinar. Thank you for taking time out of your day to spend some time with us. And we are honored today to have Rodolfo Perez back with us once again to talk about the Well Health Safety Rating and Well V2. For those of you who attended the webinar we did back in November, Rodolfo came to tell us about the new Well V2 standard and the differences between the Well V2 pilot and what was in the Well V2 release, with a focus on the materials concept. And we demonstrated how we built new tools into the transparency catalog to make it really, really easy, literally in a single click, to find all of the brands across all the MasterFormat divisions that are eligible to meet the material concepts in Well. And we'll take a look at that towards the end of today's webinar. By the way, this webinar is being recorded. You will get a link to the recording in the next couple of days after the webinar is over. You will also be able to request the deck if you would like that. And in the deck, you can see the link there to the first webinar if you want to go back and watch that as well. So today the agenda is pretty simple. For those of you who are new to Sustainable Minds, I'll do a quick introduction and we'll move right into Rodolfo's presentation about Well and Well V2. And we'll do a quick transparency catalog demo as promised, and we'll wrap up in 30 minutes while you're eating your lunch. So Sustainable Minds is a software company. I founded the company. I'm Terry Swack, the CEO and founder, in 2007, when not that many people actually really cared about greener products. So we've been in the greener products software business for quite a long time, and our focus has always been the same, which is to deliver knowledge and tools to designers of all kinds of things, products and now buildings, to make better informed decisions that ultimately will create less impact on the built and natural environment and human health. Today, we are the only end-to-end product transparency solutions provider, being a program operator with a streamlined PCR and EPD development process. We deliver LCA and material evaluation services because to be building tools that streamline and make it simpler to understand this information, we ourselves need to be technical experts, and that's why we offer those services. And then all of that really rolls up to support manufacturers' marketing initiatives about the performance of their products. And so our transparency catalog is the cloud platform that makes all of this information available so people can quickly make better informed decisions and have all of the data available to choose from right in front of them in an understandable way. And that's what the transparency catalog is designed to do, is to literally in a click, make it easy to find, select and specify high performance products that meet the requirements of all of the green building rating systems that offer transparency credits. And even if you're not designing a building that ultimately will get certified to a rating system, many people today are designing and building to those requirements and are looking for those brands and those products. And we've made it easy for people to find whatever they're looking for in whatever stage of design and construction, no matter their role, super easy to use and always free, no login. So with that, Rodolfo, I'm going to throw it over to you and you can take us into the story you have to tell us today.
Thanks, Terry, and welcome everyone in the call. I'm very happy to be back here. And yeah, this time I'll talk a little bit about what we do in IWBI, how the Well Health Safety Rating was created and how it relates with Well V2. Also how materials contribute to our systems and what's next for us. And then a little bit of a call for action. Let's see. Sorry, I don't see the PowerPoint right now. There we go. No worries. And there we go. I think there we go. Now we're good. Okie dokie. And let me start from the very basics. What do we do at IWBI, the International Wellbeing Institute, and well? In simple, we try to put people's health first, wherever they are, and we're mainly in buildings. So our goal as an organization with the well movement that we want to create is to advance health in the places where we spend, our time, where we live, where we work, where we play. With that, I mean not only the absence of disease, but actually the true expression of the well-being, like your mental health, your societal health, as well as your physical health. For that, how do we do this? For that, we have what we say is the well-building standard that was a topic in our prior webinar, in which we collect what we believe is, good research and good practices driven by industry and science towards a better health, in a very holistic perspective within buildings. And it's the foundation of this well-building standard is the foundation upon everything we do around is built. So we have our well-building standard, and how do we express this? How do we communicate this? How do we implement whatever this standard says? Depends who are we asking for. For instance, if for buildings might reach well certification. If we have corporations, organizations that might want to scale up the well certification or align their strategies to ours that we write in the well building standard, we have the well portfolio program. For people that might be interested to learn more about what we do or want to apply what the well building standard says, we have the well AP, the professional accreditation. Now, for companies that provide services or manufacture products that are aligned in nature with the nature of well, we have a membership program. And finally, and more geared towards reentry on buildings and for organizations, we have created the Well Health Safety Rating, which will take most of the time in the presentation today. So all these movements, all the people, the places that are actually seeking us, that are aligning with us at this moment, are growing quite a bit. In the last year, for instance, we had not even like 10,000, even half of what we have now in terms of well AP community. Just in a year, we have doubled the reach of our community. In terms of spaces, same thing. What we used to take us years to get, now we take it, in a few months. So we're definitely growing. For instance, we had people in now almost 100 countries. This number almost doubled again in the last year. So our geographical and our as well as like a footprint in terms of spaces being created is growing significantly. So we're definitely, I think, in the right track. We're growing. We're inviting you to join the movement in one way or another, because we're definitely growing. Probably one of the silver linings of COVID is this understanding that finally health matters. So with that, let's take a little bit of a view of the foundation, which is Well V2. And Well V2, the standard, the well building standard, in its second final version, which was released almost 7 months ago, it codifies all these good practices for buildings and organizations to put people first into 10 concepts. Some of them are related with indoor environmental quality, like air, parts of water, parts of light or sound. Some of them target particularly mental health, think of mind, societal health, community, the way we relate with each other, and some of them have a mix of, all these parts together. Think, for instance, in nourishment. There's a little bit of disease prevention as well as health promotion, again, in this holistic view of what health means. Also note that materials is one of these 10 concepts, and the one that we are going to take a little bit of a detailed look later on. Now, we have, so this is the kind of the big framework where we have our system, the well V2, the well building standard. Now we created the well health safety rating last year. We released it around June, and it's basically a subset of the strategies presented in well V2 that are geared towards operations by organizations in buildings, and mainly geared towards healthy and safer re-entry to spaces. We wanted something that people that go to a place feel comfortable going in, because the organization supports that place can tell people, or can tell everyone that they do whatever they can to address safety, and and in a holistic way, not only the physical part, but also the mental, societal again. So to get here, we were about to release a well V2 around March last year, and COVID happens. So what we did was to convene experts on the field of public health from all over the world, China, US, Canada, UAE, of many other countries, and we convened them and create this task force to do two things. First of all, gather some feedback of what we're releasing of well V2, like the whole system, but also propose guidance of what to do with the impending crisis. And we check also with our advisors. We have groups of advisories that support us as people developing the well standard. And and we look at the guidance from respectable institutions around the world. So with all of this body of knowledge put together, we came up with the idea and developed what is this well health safety rating. I say that this is a subset that focuses on operations in terms of compared to well V2. So if you think about the 10 concepts that encompass well V2, our well building standard, now in the health safety rating, we selected strategies of 6 of these 10 concepts that I'll describe in the next slide. But before that, I want to tell you that the whole concept within this well safety rating also encompasses some characteristics that make it very easy to scale up to many different spaces. For instance, we have office buildings, arenas, stadiums, you name it, restaurants, even ATMs. Following this. Also, it's operational, so it's verified basically by looking at your practices that you're implementing. We do not do performance testing, or no one goes to spaces to test, which is part of the well building standard, the whole version. That makes it also scalable and accessible because there's no capital expenditures. This is based on operations. And from the well building standard, we took some pieces and regrouped them into these 5 topics. The first topic, cleaning and sanitization procedures, might sound the most familiar, like hand washing, touchless reduction, touchless surface encouragement, cleaning protocols, cleaning products. We also have emergency preparedness, which seems pretty necessary, health service resources for those entering and occupying a building, air and water quality management. Ventilation is key. We all know it for COVID in particular, but this can go even beyond that. And finally, communicating the actions of the building towards better better spaces to the people who actually is the main beneficiary, whoever enters the space. And also we talk about that, we try to make spaces and organizations focus on the health of people. So we need to communicate that. And for that, we need a sign. And that's where the well health safety rating includes a seal that can be easily recognized, that can communicate that people, communicate to people that organizations do whatever they can to address re-entry in the safest possible way. So the well safety rating comes with a seal. And not only that, but we want to double down on that message. And to do so, we enrolled people that you might know, like Lady Gaga, Jennifer Lopez, Michael B. Jordan, Deepak Chopra, Venus Williams, Robert De Niro, among others, to start a media campaign to look for the seal, to make sure that people, like everybody, can recognize the seal as a sign of, of good practices being implemented on that building. So this campaign that we released on January 25th, I believe, of the year, took over the airwaves on all type of media, TV, social media, news feeds, you name it. You'll see this celebrities going after you, telling you to look for the seal. And we believe in this way, we actually make people aware, that there's a way to ensure, or at least to certify that the organizations are doing the best they can to make space safe. And this campaign right now, it's in a little bit of a pause, but we'll be back, and rather sooner than later. Among the organizations leading this well health safety rating that have implemented or are pursuing the rating are some marquee buildings, Empire State in New York, as well as many of the professional sport teams in the US and in Canada. Some of them listed here: the Yankees, Spurs, 76ers, Sacramento Kings, the Cavaliers. We also have organizations that run malls, for instance, Brookfield, Simon, educational facilities like the National University of Singapore, proving that this is not just the US, actually a worldwide system. We have a large complex in India as well, RMZ Properties. We have a public school system, Fairfax County School, as well as organizations like health in healthcare and banks, as I said earlier. Now, with this is, as I said before, a subset of well V2. What we want to invite people is to think of also the well health safety rating as a means to commit to a bigger commitment, which is to sustain the re-entry and the operational facilities into a more long-term and more even holistic, that doesn't address just the need of safety in this place for acute disease, but for the entire well ecosystem. And we do that through the Well Portfolio Program. The Well Portfolio Program is our premier product to put people first on organizations everywhere. So that is about the well health safety rating. Now, how about materials? We're here as a community of the materials manufacturers, architects, designers. How can we help towards achievement of the well V2 and the well health safety rating? From the well health safety rating, materials definitely cover an important role. Materials in general, when we talk about materials in well, we talk about remediation of legacy contaminants like lead. We also talk about when we put new materials, new building materials, to put better materials that healthier, that have less chemicals of concern. Also, we talk about good operations. We talk about material consumables like cleaning products that might interfere or might be damaging or not to those using it and enjoying the space after it's clean or disinfected. So some of the features that we have, and the codes in green are the codes that you see them in Well V2, which I invite you to look at. Cleaning and product protocols is part of the health safety rating as well as Well V2. And in that, we want better cleaning practices as well as products with less hazardous or harmful components. And we have a list of components like based on their hazard rating that we try to avoid. We also have in well health safety rating this contact reduction feature that is says beta because it's new, informed by the task force that I mentioned earlier, and that's how we began developing it, and includes strategies to address respiratory shedding of particles to avoid the contact, so pretty much straightforward for COVID, as well as reducing the number of fomites by reducing the number of touch points that you might need in a space. Think of like a faucets, for instance, air dryers, or water faucets. Also in well V2, but not in the pilot, I want to highlight a few things. First of all, we have a VOC reduction in content and emissions restriction, close to what LEED does. And we also have in well V2 air testing. So air testing includes VOCs. So the best way to reduce the number of VOCs is not to have VOCs. And also one thing I really want to mention for this audience is the materials transparency. In the well materials concept, you can have up to 12 points and 100 towards the achievement of the well platinum status in well V2. So out of the 12 points you can get in materials, 3 can be awarded for just material transparency, depending on the level of transparency that is provided by the manufacturer. So the level of disclosure and the level of openness about the disclosure and who performs the disclosure. And finally, we also award materials that have free of red listed compounds through few rating organizations that publish this type of list, or have been certified with organizations that go the next step and analyze the product in a more holistic way towards safety. Now let's see. So this is what we do so far. So we have well V2, we have the health safety rating, we have the materials engaged in them. Now what's next? And how do we support this? So we are a research-based organization, and as such, we want to make sure you have access to the research that came to shape these features. And I invite you to download the research digests, which the link I'll show later. And that's how we got to well V2 and the health safety rating. But also we have the global research agenda, which is a document that highlights and puts in a model how to combine what is buildings and health into one theoretical framework. And with that, we can evaluate what are the needs that need to be addressed towards putting people first in places. And with that, we have issues that are like, that we know, like climate change, and others that are really critical that you might agree with me, like healthy materials. Definitely there's a research gap that was identified by that group, and there's a call for action on that end in that document. To finish, now we think when we talk about health, we need to think of health for everyone. And equity, it has taken a fundamental presence in what we do at Well, and we launch a network of advisors to make sure that whatever we do is works for everyone. Health has an important, it's not fundamental equity component that I think everybody in this call might be aware of. Lead in buildings has risen the case of intellectual impairment in some kids. Things like that. Equity and health go hand in hand. We can't have one without the other, and we want to bring that forward as well. So I want you to think about how we can incorporate equity in what we do. And with that, just to wrap up, the call for action. I mentioned things that you can do to collaborate or to join the movement. You want to learn more about Well V2 or download the Research Digest. These are the websites. Same thing with the Global Research Agenda. If you're interested to become a Well IP and learn more about even deeper, or align with us if you're a manufacturer or a service provider, you can do so. And for now, also look for the seal. I was yesterday at the office. I went downstairs and found the seal actually in the ATM. So you're welcome to look for it. And with that, thank you very much. This is the end of my presentation. I think it's back to you, Terry.
Well, thank you, Rodolfo. And we will be including those links to all the take action options that Rodolfo provided. Those will be in the follow-up email, again, that contains the link to this recording. And so just a quick look at the transparency catalog. Again, our goal is to revolutionize green building product selection, specification, and procurement to help building product manufacturers grow by making higher performing, greener and healthier products to deliver to the market. And so it's really a win-win for everyone if we can really simplify the delivery of that information in any stage of design through build. People will find the brands and the products from the manufacturers who have invested in transparency. And when those products get purchased and more buildings get built to high performance criteria, those manufacturers will keep making more. So today in the transparency catalog, it's always growing. Our commitment is that it's every single building product and manufacturer in North America who's investing in one or both types of transparency documentations. We have every EPD. In North America, we have APIs with the HPDC, Declare, Cradle to Cradle, and we have a very proficient data management team that is continually updating and maintaining the data so that our commitment again to the industry is when you come to use the catalog, you're going to find everything that is available and it's current and up to date. So launching the transparency catalog, it was designed to help people find the materials and products to meet the green building rating system criteria that offer transparency credits. And here you can see a close-up of this filter. Last September, we enhanced this rating system filter by creating a subsection just of the optimization credits. So now you can come to the catalog, select any master format division and section. If you're looking specifically to find materials, again, in any master format section that will contribute to earning the WELL credits, all you have to do is click that rating system box, and that's what you'll see. We have a page in the transparency catalog where we map all of the green building rating system credits, this column, to the organizations and the disclosure types that they create, so that you can see if you're interested in kind of studying what's available in the marketplace. And this is, again, free. Anybody can go look at it. And these are the correlations that we maintain, that our data team maintains, so that you're sure that when you use the transparency catalog and you click on any of those green building rating systems or disclosure types, you're going to be getting the results that do meet those criteria, and you don't need to worry about that. We're actually at the end of our time, and I'm going to wrap up by quickly just going to the catalog for those of you who have used it before or have never seen it. Here it is, transparency catalog. You can pick any master format division. You can add a section from the front page if you like or not. You can add a brand name to get quickly to just the brands, a brand you like in a master format division or section, again, in a single click. So I've clicked on division 7. And even before I click on any of the sections, I can, again, go down here to the rating system credits, click on any of those filters. And again, what you're going to get is all of the products, all the brands and products in Division 7 that meet the WELL rating system criteria. So that's pretty great to know that in Division 7, there's 100 brands and almost 1,500 products. And then, of course, you can go in and continue now to drill into the master format sections and really just drill down to the stuff you're looking for and get those brands and products. So that's today's webinar. I hope you guys learned something new that you're able to take back to the people that you're working with or that you're living with. And if you want to come back again, we're doing this again next week. Tell your friends, anybody can register in that time frame. And we encourage you to reach out to us if you'd like to schedule a demo for your organization, whether you're a manufacturer or an architect, engineer, contractor, or building owner and developer. We are all about helping people find the right brands and the right products for their high performance building projects. So thank you, Rodolfo. You guys are doing a great job at WELL. We're so excited to see you bring material health and human health to the general public in a way that gets them excited. And I think everyone was really floored by the campaign, so we look forward to that restarting.
Thank you, Terry. My pleasure too, and thanks for all what you put in. I mean, after all, in transparency is all about health. So, I'm happy to work together and present together. Thank you for the opportunity.
All right, well, have a great day.